My name's Sanjay Menon. I'm an orthopedic surgeon at BayCare Medical Group. I'm board certified in orthopedic surgery and also did subspecialty training in sports medicine and arthroscopy. Well, I did my medical school at George Washington University, and then after that I did a residency in orthopedic surgery at Harbor UCLA Medical Center in Los Angeles. And then I did my subspecialty training with Dr. James Andrews in sports medicine and arthroscopy up in Gulf Breeze, Florida. In general, when I meet a patient, the first thing I want to do is get to know them because, we don't want to just look at an x-ray or an MRI and treat that. We want to treat the patient in front of us. So I really like to take some time to get an idea of what people like to do and what might be affected by their shoulder pain. And then we can figure out a plan to treat that. And for many patients, that may not involve surgery. It may involve something like therapy or learning a new way to do some of the activities that they like to do, such as exercise, in a way that may not cause them the pain that they're having. Well, one of the most common questions I get from patients is, why do I need an x-ray if a rotator cuff tear is identified on an MRI? And I always advise patients that an MRI is like looking at your shoulder with a magnifying glass, and an x-ray is like taking a step back and evaluating the entire shoulder. And so while it's extra helpful to look at an MRI, it's also helpful to get perspective from taking a step back. And it can actually tell us a lot about whether there's arthritis and whether we need to be thinking about something more like a total shoulder rather than a rotator cuff repair. I always like to talk to patients about prevention so that we may never have to discuss surgery. And in terms of prevention for shoulder injuries, the most important thing is to exercise these small muscles of the rotator cuff when they aren't injured. And that is how you prevent the injuries. And there's some simple exercises that if a patient were to speak with me or with their physical therapist or a personal trainer, they could use to help to prevent their shoulder from going on to a rotator cuff injury. One of my favorite parts of my job is that I get to work with athletes of all ages. I actually volunteer for many high schools to provide medical coverage for the high schools, and I take care of a lot of the athletes when they get injured. And it's really exciting to see those kids get better and get back out there. And then when you get to the college and professional athletes, it's really exciting to see how motivated they are and how well that they can do with the surgeries that we provide. And so in providing medical coverage for some of the professional sports teams in the area, I get to see a little bit of that and also work with the athletes that are probably going to be professional athletes one of these days too.